is Chenelle Martin, and I'm doing a video validation for the maintenance of a continuous PEG feeding. So I've reviewed the physician's orders, I have gathered my equipment, I've washed my hands, and I'm ready to enter the patient's room. So I enter the patient's room, making sure to provide privacy. I want to check the patient's ID band, making sure that it's the right patient. I want to introduce myself to the patient and explain today's procedure. I want to turn off the feeding pump, raise the bed to a comfortable working height, and raise the head of the bed approximately 45 degrees. So I want to draw back the blanket, pull up the gown, and expose just the midsection. And I want to assess the region, the abdominal region, for any distension. And I want to auscultate for bowel sounds in all 4 quadrants. So with an alcohol swab, I will clean the diaphragm and let it dry, and then auscultate the 4 quadrants. Okay, and from auscultation it is evident that there are bowel sounds present, and there seems to be peristalsis present in the abdomen. So I want to now gently palpate the 4 quadrants for any distension. I want to ask the patient if they're experiencing any abdominal discomfort, any nausea. The patient said no, and we're ready to proceed. So I want to wash my hands and don my clean gloves. I want to remove the container from the tray and remove the protective pad. Place it on the side of the patient, making sure not to get any gastric juices on the patient, on the bed, or myself. Okay, so I want to get the syringe, kink the tube, remove the pump feeding. I'm going to insert this in the PEG tube. I want to draw back on the plunger, and I want to note the color, consistency, and the amount of the gastric contents. And in the event of receiving more than 100 cc's of gastric contents in the syringe, I want to discontinue feeding. I want to discard the contents and notify the physician. But in this case, we have received approximately 40 cc's of gastric contents. So I want to reinstill it into the patient by pushing on the plunger. I'm going to kink the tube. I'm going to put the cap on. Then I want to pull out 30 cc's of tap water. Going to kink the tube once more. Going to uncap. And I want to unkink and irrigate the tube. Going to kink, remove the plunger. Reinstill the tube, unkink. Then I want to turn on the feeding tube, the feeding pump. I'm going to clean up the area, removing the protective pad and discarding this. I'm going to make sure that the patient is comfortable, maintaining patient privacy. I want to leave the call bell within reach of the patient. Put up the side rails. Lower the bed to the lowest position. I want to set the rate to the original rate. I'm going to add any additional feedings if necessary. And I'm going to make sure to change the pump every 24 hours. I'm going to clean up my materials and store in a clean, dry area. I'm going to remove my gloves and discard. And I'm also going to wash my hands and make sure to document the findings in today's procedure. That would be the color, consistency, and the amount of the gastric contents on my I&O chart and the flow sheet and the nursing notes. And I will make sure that the patient's comfortable. And that concludes my video for today. Thank you.